pain is a signal that something is going wrong now. And if you fix that now, your pain will become less now. I don't care whether you've had it for 20 years. It doesn't matter. It's not going to take you 20 years to solve this. You've had it for 20 years because everyone's been looking at you from this component thinking standpoint. So you just haven't had the right information yet. So fix these issues, just like bending your knees when you're lying on your back feels so much better for your back. Well, that didn't take 20 years for that to feel better. It felt better right now, right? Why would that change if we started fixing things to make you feel better? You should feel better right now.
Welcome to the Fredrickson Health Show, highlighting expert practitioners from health, fitness, injury prevention, functional medicine, and integrative medicine. If you are into upgrading and optimizing your health, this podcast is for you. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here is your host, Dr. Robert Fredrickson.
Hey everyone, thank you so much for joining us again on another episode of the Fredrickson Health Show. Today we have Rick Olderman, who is a orthopedic physical therapist who specializes in chronic pain management. He has written the book, Fixing the Chronic Pain Puzzle. Did I say that right?
Solving the chronic
pain puzzle. So we're going to solve the chronic pain puzzle today with Rick Olderman. Rick, thank you so much for coming on today.
Oh, my pleasure, Robert. And even I got it wrong because it's actually solving the pain puzzle, not the chronic pain puzzle.
Solving the pain puzzle. People find it anywhere you can find this book to be sold. So Rick, how did you tell us about your background first, and tell us about this transition that we talked about earlier from how you started as a brick and mortar PT to now how you transitioned to telehealth to how you've written your books. And I want to learn all about that from you today.
Sure. I'll try and keep it as short as possible to so we can actually give some helpful advice to people. But I started as a PT, and very quickly I realized I did not have the tools to help anyone with chronic pain. I was an utter failure at anything more chronic. And so I eventually moved to Denver. And when I moved here, my schedule was instantly filled with all of these other people. I worked at an exclusive health club downtown. I was the only PT on staff there. They had never had one before. So when I joined, all of a sudden my schedule was filled with people with pain. And these are well-to-do people, young people, had great insurance. They had seen all these doctors. And I finally realized, oh man, it's not just me who's having trouble helping people with chronic pain. It's everybody. So that's when I realized I've got to try and figure this out. So the last 25 years, I've been figuring this out. And I wrote an initial series of books called the Fixing You series on Amazon. I wrote those about 10 to 15 years ago. And that was because I realized as practitioners have a belief system about what they believe should be helping their patients and how they should be practicing, right? And so what I had learned, though, is that the systems-based approach, which is what we're going to be talking about largely today, is different than how we were trained. And so even though a lot of patients could benefit from this, practitioners wouldn't use it because they believe that they should be working with their hands, like manipulations or soft tissue work or e-stim or just things like that, acupuncture,
Sure,
to solve pain instead of fixing the systemic problems that are causing pain. Well, in my experience, fixing systems problems is much quicker and long-lasting than other types of treatments. But because of practitioners' belief systems, they wouldn't use these types of approaches. So I wrote my Fixing You books as an end around the practitioners to give it directly to people who need it because they weren't hearing it from their practitioners. Then I owned my own clinic for about 10 years. And, I got to see this from a very large volume and saw that actually there were patterns of problems occurring. And so that's when I created my digital home programs, which are much more succinct than what are my books, believe it or not. They're simpler and more comprehensive at the same time. So they'll help people even faster than my books have. And so I sold my clinic last year because, as you imagine, having a brick and mortar clinic just is not very profitable anymore. What it entailed me doing is starting to cut treatment times and doing all of these things to, make things more profitable. And I just didn't enjoy doing that. So I sold my clinic, and now I'm completely digital, I guess you'd say, or off, non brick and mortar. And so I sell my digital programs. I help people via Zoom, and I write my books. And my recent one is Solving the Pain Puzzle, which flips the strategy I used in my Fixing You books. My Fixing You books is about the anatomy, biomechanics, and so forth that's causing pain. And the Solving the Pain Puzzle, the subtitle is Cases from 25 Years as a Physical Therapist. So this is drilling more into the people that I helped and how I use this approach to help these people. And so it's a much gentler way of being introduced to a systems approach to solving pain, and kind of talks about my journey of getting there.
Rick, thanks so much for sharing that. I mean, for anyone watching the video, it looks like you're in a PT studio behind you. It looks like you have like the perfect setup for doing, telehealth with their patient. You can demonstrate all the exercises in person. But that's like a dream goal, is to have that type of gym or setup. So very cool.
Oh, well, thank you. Yeah, I'm lucky to have it.
Yes. Well, Rick, and something you said earlier is you stated how when you first got out of practice, you felt like you weren't meeting your patient's needs, and you said that you may have felt like a failure. Why was that? Was that just from what you were taught in school, and what did you have to learn on your own, and what did you study to kind of to get better patient outcomes, and what did you find that was lacking as well?
Yeah, Robert, that's a great question, because people don't understand how we're trained in medicine, and therefore what they're missing. And so really the way that we're trained in medicine, and you can probably confirm this, is we have 1,000 tests to identify specific tissues that are damaged, right? In physical therapy, we have all sorts of orthopedic tests. We also have x-rays, MRIs, all sorts of things to say, hey, this is what's damaged. And in school, what I was taught was to then, okay, we're going to focus on that tissue. We're going to treat that tissue, and then it's going to feel better, and it's going to heal, and you're going to be on your way. Well, that works really well for acute issues, right? Relatively recent issues, tears, sprains, breaks, post-surgeries, all sorts of things like that. But what I found was that it does not work at all for chronic pain issues. There's a different set of rules that we have to help these people with. And so it wasn't that I felt like I was a failure. I was a failure. I could not help them given these tools I was given in PT school. So I refer to that type of thinking as component thinking, because what we're doing in school is breaking the body down into these components, learning what those components are, and learning how to treat those components. But there was nothing in school that talks about how those components are working together as a bigger system, right? And so that's what I call my approach now, is systems thinking, it's much different than component thinking. And so when I realized that I was a failure at helping people with chronic pain, I thought, gosh, my basic premise was, because I had back pain prior to going to PT school. I also had extensive neurological damage in my neck and shoulder from high school football. So I had chronic neck pain as well. And I knew that something I was doing was perpetuating this pain. I knew it was my fault. How I'm using my body must be causing this to happen, right? And so anyway, after I realized I was a failure, I thought, I don't know of any other practitioners that look at the body like that, as a systems approach or things like that, until I remembered Dr. Shirley Sarman out of Washington University School of Physical Therapy in St. Louis. She's a PhD PT there who's been teaching for decades and has written over 120 different research articles on movement impairment syndromes that cause pain. So I read her textbook several times. I took her courses, and that's where I learned the systems biomechanics to solving pain. That helped tremendously. In fact, I use most of my biomechanics is based off of her teachings now. But as you probably ran into, Robert, soon a different layer of patients starts knocking on your door, right? People who are a little tougher. And these people weren't responding to just the biomechanical solutions. So I had to start looking broader for these people's solutions. And that's when I discovered Thomas Meyer's work with fascia. He wrote a book called Anatomy Trains.
Great book.
Fascia, for those of you who don't know, is connective tissue that connects everything to everything in our body. It holds blood vessels in place. It connects muscles to muscles, muscles to bone, everything. Holds our nervous system in place. It's deeply connected. But he identified super highways of fascia that run from our bodies from head to toe. And so when I read his book and I saw what he discovered, I thought, oh, well, that then means that anything along that superhighway will influence anything else along that superhighway. And so that helped give me permission to start looking further away from where pain was happening as a potential source of pain. And that then also helped. But then the next layer of patients started knocking on my door, and these people seemed to have a battery that was inside of them that was charging up their bodies to have these patterns of contraction that were happening. So if I fixed everything biomechanically, I worked on it fascially, the next day they'd come back and it would be all back to zero again. And I'm just like, what is going on? What is this battery that's driving this recontraction pattern? And so that's when I discovered Thomas Hanna's work. And he studied neurological patterns of dysfunction that cause chronic pain. Well, here's the fascinating thing, Robert, is that Shirley Sahrmann, who focuses on physical therapy, Thomas Myers, a fascial expert, and Thomas Hanna, a neurological expert, all came up with the same 3 patterns of issues that cause almost all spinal pain. And when I got Thomas Hanna's information and I put that together with the other 2, I was just like, my head just exploded. I just felt like I finally had the 3 pieces of this puzzle: biomechanical, fascial, and neurological. And so what none of them did, though, was they didn't drill down into what we were doing in our daily routines that were causing these 3 patterns to occur in our bodies. And so that's what I've been drilling down into for these last 20 years or so, is trying to figure out, what these patterns are. So my Fixing You method approach is really combining the biomechanics, fascia, and neurological techniques together with the behavioral techniques, and then that rapidly eliminates pain. So in a nutshell, that's what's going on.
Thank you for sharing all of that. And I'm not sure what happened to my video here, but for anyone listening, take us how you would do a biomechanical approach, or how you would evaluate somebody who came in. Let's say they hurt their knee. What would you look at for someone who hurt their knee that's not their knee?
Yeah. Well, I'll tell you what. We can talk about knee pain in addition to back pain, because
Sure.
Back pain is probably the most commonly misunderstood problem out there. Okay. So with back pain, there are these 3 researchers identified 3 common patterns that cause almost all back pain, but I've kind of drilled it down to 2, because 99% of the people have these 2 patterns going on. And one is that the back is either too arched, or there are too many forces pulling it into an arch. And I'm going to take your listeners through a quick and easy test to determine if this is their pattern. Okay?
Please, yes.
So all you have to do, folks, this is really easy. And for you really to get the most out of this podcast episode, it would be good for you to actually do this test so you can feel the truth in your body. Okay? So what I'm going to ask you to do is lie down on your back with your legs straight, preferably on a floor. But if you can't get on the floor, then do it on your bed or your couch. And we're going to lie there for about 30 seconds. And I want you to feel how your back feels in this position. And then what we're going to do is we're going to ask you to go ahead and bend your knees and see how your back feels in this position. And the question is, does your back feel better with your legs straight or with your knees bent? And Robert, I bet you know the answer to that one. What, in your opinion, which position would be better?
Knees bent.
Absolutely. Almost everyone with back pain feels better when their knees are bent, lying on their back. Okay. So the easy answer is that, when my knees are bent, my back is more flat. And that's part of the correct answer. All right. And we'll go into this a little bit more deeply, what's going on here. So that's the first part of test 1. The second part is, now everyone stand up and listen to this podcast for the next 2 or 3 minutes. And what you'll notice is when you're standing up, that as you stand longer and longer, your knees start locking straight more and more. Okay. And you'll notice, and if this hasn't happened in you yet, go ahead and stand up and lock your knees back and feel what just happened to your back when you did that. Your back is arching more. And now unlock your knees ever so slightly, and you'll feel that back is now arching less. And if you're not sure, Lock the knees one more time, and you'll definitely feel that the back is arching more, and that your lumbar muscles here in the low back have started to kick in more. All right. So what is this telling us? Well, the first test is telling us that, gosh, when my back is more arched, it hurts more. And when my back is flatter, it feels better. And then the second part of the test is saying, oh, when I'm standing for more than a minute or two, I'm locking my knees. And so when I lock my knees, my back arches more. So with the way I habitually stand then is causing and contributing to my back pain. And so the locking the knees doesn't only happen when you're standing. It primarily happens when people are walking. So if we're walking 10,000 steps a day and we're locking our knee with each one of those steps, each step becomes a little hammer on your back, forcing it into this extension pattern that's actually causing your pain. And so that's how an unconscious daily habit is contributing to your pain without you knowing it.
Thank you for that. That was so great. And for anyone listening, go back. If you didn't stand up, if you didn't lay on your back and, have your knees straight, then bend your legs, do that. Feel how your back feels. So Rick, what would be a correction if someone is, walking and they're locking out their knees? What would you do to maybe cue them in to what they're doing and correct that so they can start to feel better?
Well, once they see this pattern, then, so this is the interesting thing, Robert, is that, let me take you through another test to demonstrate.
Sure. Yes. Yeah, please.
So clasp your fingers together as if praying. Go ahead and do that right now. Which thumb of yours is on top? And folks at home, do this too. Which thumb of yours is on top?
Mine's left.
Left thumb is on top. Okay, without looking at your hands, I want you to unclasp your fingers and now reclasp them again with the opposite thumb on top. A little awkward, isn't it?
It is. Yeah, you had to think about it. I had to think about it. Yeah.
And now you can look down and confirm that your right thumb is on top instead now. Okay, is it? Now hold your fingers like this. So right now your brain is saying, ooh, this is weird. I don't really like, this isn't how I usually do that.
Sure.
Right. And then there's another part of your brain that's judging that as a wrong way to do this. Okay. Those are two different messages. So, but what if you found out that clasping your fingers like this solved your pain? Your brain would then continue to say, this is different, but now that judgment part would be wrong. And it would say, oh, but this is helpful. So your brain would start looking for you to do this pattern because it knows that this is helping your body. All right. So you can unclasp your fingers. So what that's telling us is that when we start doing something, a small change in how we do things with our body, we're going to get a couple messages. One is that alert will come on and say, hey, you've just changed something big, right? And the second alert is, it must be wrong because that's not how you taught me to do this all my life. So to answer your question about unlocking the knees, once I understand that arching the spine is hurting your back and that locking the knees is causing you to arch your spine, you make the connection that I've got to start unlocking my knees. And you turn off that second bad message that something bad is happening. And you're only going to recognize that, oh, yeah. And now you're going to say, oh, yeah, now I'm unlocking my knees. There we go. And my back feels better. Instead of, I'm unlocking my knees and I don't like this. All right. So that's a really important thing to understand is that if you're changing a habit around your pain, you're going to get those two messages, but only one of them is correct. That something is different. It's not wrong. So to answer your question, what do we do to help people unlock their knees? Well, I simply place a little piece of tape on the back of the knee initially so that whenever they lock it, it stretches the tape and cues them to unlock their knee again. And usually people just need that for maybe 2 or 3 days and then they get it. And their back feels better, usually by 50% in 2 or 3 days, just by unlocking the knees alone. It's huge.
That's amazing. That's a great example too, with just the messaging that our brain gives us, because when I clasp my hands together, I want to put left on top of right. And then when I did the other side, it doesn't feel natural. The whole time I'm like, no, I don't like this. My other finger's crossing the other finger in a different way. And, I'm like, it doesn't make sense. But if you teach your body, hey, this isn't bad, this actually can help you. And I think we can do it for a lot of different things, actually. If we just change the messaging for our brain for, hey, like eating healthy food. Yes, it might cost more for eating out, but it's going to have, I'm just making up stuff right now. But anyways, the point is the brain is very powerful.
Yes, it is. And now I'll string it together with your original question. You wanted me to ask you about knee pain.
Sure. I was just, yeah,
Okay.
if you want to go there. Yeah.
All right. So locking the knees is one of the most common habits that most people do. And if you look at the body from a system standpoint, whenever I see someone with back pain coming into the clinic, I evaluate them from the rib cage all the way down to the foot. If you come in for knee pain, I evaluate you from rib cage all the way down to the foot. If you come in with foot pain, I evaluate you from rib cage all the way down to the foot, because it's all part, the whole system works together. The system works up as well as working down. Okay. So we have to understand what the whole system is doing to solve that chronic knee pain. So knowing that locking the knees is one of the most common egregious things that you can do and that most people do. What I've also found is that there's a little muscle behind the knee called the popliteus muscle.
Mm-hmm.
It runs from the inside of the knee to the outside and crosses the knee joint. Therefore, it helps control rotation of the knee, but it also guards against knee hyperextension. So the more that you're locking your knee habitually, the more you're irritating the popliteus muscle. What does a muscle do when it becomes irritated? It contracts.
Mm-hmm. Becomes tight.
Right. And this muscle, because it's a rotation muscle, it's just like wringing a rag. The more you wring your rag, the closer your fists will come together because you're increasing compression, right? And so that's what's happening at the knee joint. The more you're locking your knee, the more you activate the popliteus muscle, which then contracts and causes excessive contraction in a locked, rotated position. And this is what causes a lot of chronic knee pain. So the same thing that can help your knee is the same thing that can help your back, SI joint, sciatic pain, and so forth. And this is why I say solving things from a systems point of view, if you throw a little pebble in the pond, there are huge ripple effects. And that's the way it is when you start changing habits about the body. As long as you know what you're doing, those ripple effects will have huge implications for pain.
Spot on, Rick. So Rick, what are some, I know back pain, neck pain are very common. What are some of the most common movement imbalances that you see? You know, it could be from sitting, could be from walking, like you stated. Anything that you typically see that people can have some quick fixes to help them. Maybe it's work ergonomics, work posture. What are some things that you see that people typically do, and how can we fix it?
Sure. So from a lower body system standpoint, the walking and standing habits, no one got out of my clinic who had any kind of back or lower body issue without learning how to walk correctly. All right. The first step, so to speak, of walking correctly is to unlock your knees. All right. So once you master unlocking your knees, then you can fix your gait pattern. But you can't fix your gait pattern unless you stop locking the knees first, is what I found. So that little piece of tape behind the knees, huge help in that regard. So what's going on with walking that's wrong and that we need to fix? Well, most people, you'll find when you walk, you put your foot forward and you heel strike.
Mm-hmm.
Well, the moment that you strike that heel, your knee is thrown into that hyperextension. When that knee is thrown into that extension, it turns off key hip muscles, which then control the hip joint, the pelvic orientation, and the lumbar spine. So therefore, the way to start fixing your walk after you stop locking your knees is to allow your body to come forward with the advancing foot instead of the advancing foot coming forward without your body. All right. So whenever your foot is coming forward, your body should be moving forward with that foot so that your body is over the foot at foot strike when you strike that foot. When that happens, your knee will automatically be unlocked. And what that will start doing is turning on these key muscles that have been turned off for months or years that are the root of your chronic pain issues. So that's the biggest one for most people with lower body system issues: back, hip, knee, foot, whatever.
So you're basically saying to keep your leg when you're walking underneath your center of mass and not out in front. And so that if you're doing that, you're naturally not going to stomp that heel down. You're not going to have that knee that's locked out, and you're going to have a more comfortable position. Do you find that in training people to do you ever like make them do barefoot training in order, because it's very hard to heel strike if you're barefoot because it hurts, right?
Right.
Do you ever incorporate that, or is it more, hey, like we need to just fix the gait? And how do you incorporate that into running? Because sometimes people want to really stride out. Is there any tips for running that you do as well, or for joggers?
Yeah. So let's start with the walking one and barefoot. So if people are inclined to walk barefoot, then I teach them a barefoot technique to do this. But most people don't want to walk barefoot in order to fix their gait pattern.
Sure.
So an easy way I've devised to fix this is just to get people to walk on their tippy toes. If you walk on your tippy toes, you'll notice that it is impossible for your foot to land out in front of your body.
Mm-hmm.
And your body is always over the foot at foot strike, and your knee is always, it's impossible to lock your knee when you're walking tippy toe too. So I have people take 5 or 10 steps walking tippy toe and then lower your heels back down, and your body will remember that pattern and continue with that. Especially for the first 3 days, what I tell people is, hey, every time you get up from a chair or anywhere to go and take a step, get on your tippy toes for 5 to 10 steps first to change your gait pattern and set it up for success rather than failure. After that, usually most people get it, they adopt it, and it's a done deal.
That's
a
great tip. And sometimes, like you said, simpler is easier. If you have to take your shoes off, if it's harder to do, you're not going to do it. So just whatever you're wearing.
Anyone can do that, whether you're wearing shoes or not. It doesn't really matter. Just walk on your tippy toes and you'll fix your gait pattern. And frankly, this is how rapidly a lot of this stuff works. Let's say that you have sciatic or SI joint or back pain when you're or even hip, knee, or whatever, when you're walking for, let's say it starts after you've been walking for a half mile. Start walking on your tiptoes once you start feeling that pain. And I can almost guarantee that you'll feel an almost immediate reduction in your pain and possibly 100% resolution while you're walking on your tippy toes. Why is that happening? Because you're fixing the whole biomechanical system, all right, at the same time while you're experiencing pain. So it will fix everything that needs to be fixed, and you'll see what needs to, and you'll see how much better you feel with that. And that should give you, again, that cue in your brain that says, oh, this is that I need to change how I'm walking. This makes me feel better. Now, regarding running, it's nearly impossible to run with your foot out in front of you. Your body is almost always over that advancing foot.
Mm-hmm.
So when I see runners, it's actually their walking pattern that's setting them up for failing running. I never change a runner's running pattern unless I see something really egregious with it. But what's going on is that because most people walk much longer than during the day than they do run, right?
Sure.
So let's fix the thing that they're doing most of all during the day and leave behind the thing that they're not doing a lot of during the day. And that's what I found solves running problems, is fixing the walking problems.
Thank you for that. So Rick, I'm just going to act like I'm a patient and say, hey, changing the gait is all, fine and dandy, but I'm in pain right now. How do I get out of this pain? Are there any stretches? Are there any exercises? Are there any soft tissue modalities that you can do? What do you say to someone like that? Do you prescribe stretches? Do you prescribe?
Oh, sure. Yeah, I do stretches and so forth. So gosh, there's so much to talk about, Robert.
I know.
So what we've so far covered, let's say we're talking about back pain still. All right. It's the thing that most people have. What we've talked about so far is just one of those 2 patterns that I've identified that cause most back pain. The first one is what I call an extension problem, which means that you have too much arch. And what we've talked about getting out of that pain immediately is simply unlocking your knees. I know this seems like it can't possibly help much, but I can almost guarantee that most people with back pain who are locking their knees will feel 50% better in 2 or 3 days, just unlocking their knees alone. All right. And we'll go into one other stretch that you can do to make that happen faster. But what I'd like to do is talk about the second common pattern that's causing most people's back pain. And this one attributes more to unilateral back pain or sciatica or SI joint pain. Pain on one side of the body more than a central back pain. Okay. And what that pattern is what I call a side bending pattern. And what that is comprised of is a pelvis that's resting higher than the other side and a rib cage that's resting lower than the other side. And typically these 2 things are happening on the same side. So for those of you watching this, if you can see that the pelvis is higher on this side and the rib cage is lower, that automatically increases compression on that side of the spine. Well, the nerve roots that comprise the sciatic nerve come out of the lumbar spine in part. And so they're automatically compressed, having a side bending posture.
Mm-hmm.
So, and this is very easily fixed. We can fix it through gait within 10 steps, right? But why is this pattern happening in the first place is really what we need to solve in order to permanently solve pain. So if you can imagine, let's say I have a pebble in my shoe that I'm stepping on,
Mm-hmm.
my brain, it's going to be uncomfortable. And my brain's going to say, oh, I don't want to be on that pebble. It hurts. So what the brain does unconsciously is it hikes up the pelvis to get off of that pebble. And so what it does, and the muscles that are hiking that pelvis up are also attached to the rib cage. So that same muscular contraction starts to pull the rib cage down, creating the side bending problem. Now, if this pebble has been here for long enough, even once you remove it, the brain doesn't say, oh, okay, I can drop that back down. The brain has learned to do this as your normal walking pattern. And so it holds on to this pattern, even if this thing has been solved. So the cause of a side bending problem is usually some older problem in the same side leg. In, let's say, 80 to 90% of the cases. In 10 to 20% of the cases, it's a compensation for something happening on the other side of the leg. And this goes back to your running question. I found that most running athletes, it's a compensatory side bending problem, right? They've got an older thing here and they got off of it to go over on the other side, but the other side is breaking down because it can't hold that load any longer. All right.
That makes sense.
All right. So this one stretch will help solve both of these problems, an extension problem and a side bending problem. What I have found is that if you remember, it's not only posture and movement habits that cause these patterns, it's also tighter, weak muscles that create forces causing these patterns. All right. Well, one of the primary contributors to this are thigh muscles. The thigh muscles start at the knee joint and they attach to the front of the pelvis.
Mm-hmm.
If the thigh muscles are tight, they will then pull the pelvis forward, which then causes the back to arch more. Okay.
So common.
Now, yes. And if you have symmetrically tight thigh muscles on both sides of the pelvis are pulled forward, creating this excessive arch in your back and central low back pain. But what happens with very commonly is that one side of the thigh is tighter than the other side of the thigh. And so one side of the pelvis gets pulled forward more than the other, which then causes a rotational torque through the pelvis and SI joint, therefore SI joint pain. And remember, some of the nerve roots comprising the sciatic nerve come from the SI joint, right? So now you've got torque across that SI joint. And then also because the pelvis is now rotated, the lower spine is now rotated as well. And so it's locked into a rotated position because of the thigh muscle tightness, the asymmetry here. So solving that asymmetry will also solve the sciatic, SI joint, and lumbar pain. Does that make sense?
It makes sense. What are some common causes for one side of the hip muscles, psoas, iliopsoas, quad, to become tighter than the other? Is it crossing one leg? Is it sitting on a wallet? What are some common causes that you see?
Yeah. So what I'm talking about are the thigh muscles, not so much the iliopsoas or psoas.
Thank you for clarifying. Yeah.
I know in PT school, we're all trained to work on that psoas, and that's the common hip flexor. But that, if you look at the architecture of the psoas, it's right next to the spine and it runs right down here close to the spine. And so it doesn't have nearly the amount of leverage to flex a hip as these massive thigh muscles that go way down here to the knee and attach to the front of the pelvis that's further away from the body. So these have a greater lever arm and much more muscle mass to flex a hip. So these are the primary ones that are causing the problems. I found that the psoas muscles are responding to the tightness here, that this is the stress it's creating to the spine. So these thigh muscles then pull the pelvis forward, irritate the spine, which then irritates all the psoas muscles. if you fix the thigh muscles, the psoas muscles will calm down on their own as well.
That makes sense. Yeah.
And by the way, if you, let's say the right side of the thigh muscles are tighter than the left, and this is pulled forward, then this also triggers the brain to say, hey, we've got to get off of that. And that's another contributing factor to that side bending problem that we talked about earlier. So often just stretching the thigh muscles will solve the side bending problem as well.
Perfect. Yeah. Cause I mean, I was taught the same as low back pain. Look at the psoas. It's
we all were.
It's all the psoas, right? But
we all were. But how often did that really help from a long-term perspective?
Right. But you know, some of the stretches we gave were quad stretches. So maybe, there was some overlap there. Is there any
those quad stretches typically that I was taught anyway aren't controlling the pelvis and spine well enough. And so what happens is, yes, you feel a stretch in your quad, but the pelvis and spine have gone along with it too. And therefore it's not isolating the quad well enough.
Yep.
So I've settled on one particular thigh stretch that controls the pelvis, controls the spine. And so you isolate the quad, and you don't get up from the stretch feeling achy or anything if you've done it correctly. And it is like the magic bullet for a lot of people. And this is what you were asking about a minute ago. What are some specific things that people can do? So the thigh stretch, are you familiar with the modified Thomas test?
Yeah.
Have you heard of? Okay. So the modified Thomas test, folks, you would lie down on a table, right? And your knees are up at your chest. And then what you do is you hold on to both knees, and you have to be at the edge of the table so that your leg can drop off the edge of it. So you hold on to both knees, and then you hold on to one knee, and you lower one leg down over the edge of the table with the knee bent at 90 degrees. All right. And you'll feel, if your thighs are tight, you'll feel an intense stretch in your thigh muscles.
Mm-hmm.
This knee that's up at the chest is the one that's protecting the pelvis and back, because it's keeping that in a flexed position. The more that knee comes away, right, from the chest, the more the back will arch. What we were taught in school is that kneeling stretch, or that one where you hold the leg behind you kind of this way, right? But if you do that, your back is completely arched and giving into the whole pattern that's causing your pain in the first place.
Sure.
So it's only reproducing the pattern rather than solving the pattern.
I like that. So yeah, the Thomas test is a test, but can also be used as a stretch. And so anyone listening, your body is going to be laying on a surface. Could it be on your bed, or is that too soft?
Oh yeah, I prefer a solid surface, but if you don't have anything, then bed is a great last resort.
Yeah, if you're going to bend one leg, either hold it with one leg or one arm, and then the other leg's going to fully extend. You're going to feel that stretch. And Rick, how long do you hold that stretch?
Usually 60 seconds per leg, and I do it twice per side. And I always begin with both knees to the chest first, because if you start with just one knee to the chest, your back will automatically be locked into that extended position, because one leg has been left down, and that big heavy lever arm is pulling everything forward from the very beginning. You have to start with both knees to your chest to set the pelvis and spine correctly, then lower one leg down.
Thank you, Rick. Thank you, Rick. Thank you for giving us all of your secrets. From your book. Anyone listening, Rick is giving so much knowledge right now that typically people charge for. This could actually be a session in and of itself. So, Rick, thank you again for sharing this. Rick, what would you? Yeah, Rick, what would you do for a disc herniation? Is there anything that you can share with us in that regard?
So disc herniation. So I'm working with a patient via Zoom with a disc herniation right now. And she has been through a ton of other practitioners. And the common idea behind disc herniations is that, you've got a disc herniation, you need to have more extension in your spine.
More McKenzie's, yeah.
Right. Absolutely wrong in most cases. Okay. Because if you remember, 99% of people's back feel better when it's less arched, not when it's more arched. So the assumptions with this idea that you need more back extension because you have a disc herniation, the assumption is that the disc herniation is caused because of spinal flexion. And the second assumption is that the disc herniation is the cause of your pain. What if what was causing your pain was the same thing that was causing the disc herniation?
True.
In that case, you don't want to do extension. That's the opposite of what you want to do. You want to do more flexion.
But we heard sit-ups and all that is bad for us.
Well, I haven't talked about sit-ups at all. I never do sit-ups, right?
Yeah.
So what have we talked about that causes the spine to be more flexed? Unlocking the knees when you're
Hmm.
standing and walking, modified Thomas test to stretch out the thighs, holding your spine into flexion, right? All that kind of stuff. So once you identify, that's why we started off with this primary test here with the leg straight versus knee bent. I don't care whether you have a disc herniation, spondylolisthesis, spinal stenosis, it doesn't matter. If your back feels better with your knees bent, it means that you have too many forces pulling it into an arch, no matter what structural anomalies you have in your back. And unfortunately, I was trained, it sounds like you were trained the same way. Disc herniation means that you must do these. Well, this girl's pain got worse and worse. She'd been to like 7 different practitioners. Her pain's getting worse and worse. And then finally, she's developed sciatic pain now and SI joint pain. And everyone keeps telling her, oh, you need more extension. You need more extension. Well, when is the madness going to end? So, right? So at some point, and then what she's also been told is, oh, you're going to feel worse before you get better. What? That's not the way it works. You're
Right.
going to feel better to feel better. How would feeling worse make you feel better? It doesn't work that way. Unless,
Nope.
for instance, as a post-surgery and you need to bend a joint that's been surgically operated on or
Sure.
something like that.
Right.
But from chronic pain standpoint, you always want to go, you want to let pain be your guide. Whatever makes you feel better is exactly what your body is trying to get you to do.
Pain is a signal that something is going wrong and we need to correct that. Otherwise, it's going to get worse. And
Yeah, and
so,
I would modify that to say pain is a signal that something is going wrong now. And if you fix that now, your pain will become less now. I don't care whether you've had it for 20 years. It doesn't matter. It's not going to take you 20 years to solve this. You've had it for 20 years because everyone's been looking at you from this component thinking standpoint. So you just haven't had the right information yet. So fix these issues, just like bending your knees when you're lying on your back feels so much better for your back. Well, that didn't take 20 years for that to feel better. It felt better right now, right? Why would that change if we started fixing things to make you feel better? You should feel better right now if you're doing the right thing.
exactly. Thank you for that, Rick. Rick, any comments on I know I forget the exact percentage. I think it was a New England Journal of Medicine study where they looked at people who were older and they went and got MRIs and they found a huge percentage all had disc herniations, whether they had pain or not. But the people who had pain, they then blamed all the pain on that disc herniation.
Right.
Any thoughts on that? Do a lot of people
Oh,
come to
yeah.
you with imaging that maybe
Yeah.
have that, and you're like, well, it's not really.
All the time. This current disc herniation patient is one of them. So what you're commenting on is a recent article that came out. In fact, I just cited that article in another podcast I was doing, and I can't remember the statistics. But anyway, folks, as we age, we incur more and more structural damage to our spine. Things like disc bulges, disc herniations, arthritic changes, stenosis, spondylolistheses, foraminal narrowing, all sorts of things start to happen more and more as we age. But that doesn't mean, so that is a natural occurrence. And those changes don't necessarily mean that you have pain because the majority of people with these changes have no pain at all. So the conclusion from that is you can't, and the younger you are and you have those kind of anomalies also means then, oh yeah, well, maybe those anomalies have a lot to do with your pain. But as we get older, this is natural, right? So this confirms that the pain is caused by something else other than those structural changes. And in my way of thinking, is those structural changes are occurring because of your poor movement habits and how you're using your body. Those are the things that are causing pain. And I believe they are also causing these structural changes in the spine too, not the other way around.
Right. Yeah, thank you for that. And I remember my experience seeing patients is patients would want to find an answer. There's got to be a reason for this low back pain. There's got to be a reason for this. They would want to get imaging. And we'd always just, hey, like let's do these treatments first. We'll use imaging
Yes,
if we need to. Because sometimes we might get imaging and it might show a disc herniation, and that patient's going to blame all their pain on that.
exactly.
And they've even correlated, hey, the size of the disc herniation doesn't equate to the amount of pain you're going to have. You can have a small disc herniation and be in excruciating pain. You're going to have a big disc herniation and not have any pain. So really, the imaging can kind of, not tell us that much if you're not actually getting to the root cause, like you've explained.
You're absolutely right, Robert. Absolutely.
Okay, so let's go to some so that was amazing, by the way, Rick. Thank you so much for helping us understand low back pain, what we can do on a daily basis. Thank you so much for that. Sure. What about for neck pain? So many people sit all day, they have text neck, looking down at phones, looking at screens. What are some common things people can do to help with their neck pain?
Yeah, well, I'm so glad that you got here, because this is one of the even more misunderstood areas than back pain is neck pain. So folks, if you look at a picture of the skeleton, you'll see that we have all of these long bones, all right? And I want you to think about these bones as lever arms. We have long muscles that attach to the long bones and move these long bones. We have two places in the body, though, that have wide, broad bones. One of those is the pelvis. We understand that the pelvis is the center of function for our lower body, pelvis, and low back health. The second area is the shoulder blade. The shoulder blade, it turns out, is the center of function for all shoulder, elbow, neck, and head issues. It's the center of function for our upper body system, just as the pelvis is. So there are rules about how those shoulder blades should be resting and moving. And we won't go into what all those rules are now. But know that there are significant attachments, and you can look this up, look at scapular muscles, and you'll see that there are tons of muscles that are going from the scapula into the neck bones and the base of the skull and all of the vertebra. So they have a significant role to play in chronic neck pain. And I would challenge all of you listening to think back to your treatments of all of your practitioners for your neck pain or headaches, whatever it might be, migraines, it doesn't matter. Herniated discs in the cervical spine, it doesn't matter. I bet you not one of them assessed your shoulder blades as the potential source of your chronic pain. And in my last 20 years of working with chronic neck pain and headaches, I can't remember one patient that the source wasn't the shoulder blade. It's that common. And this is why I believe we have chronic neck pain and headaches. It's because no one is looking at this shoulder blade. So what's the most common problem? And so it was interesting the way you described this, Robert. You said we have text neck, all right? Well, that's a catchy little term. And you would think, oh, with a term like text neck, it means that your problem is that you're texting. And therefore, that's why you have neck pain, right? But then that blames the problem on something that you won't possibly change. Who's going to stop texting because they have neck pain, right? Nobody.
Right. Sure, yeah.
Right? And this is what we do in medicine often, is that we blame chronic pain on problems we can't possibly change.
Sitting, looking down. Yeah.
Right. Sitting and looking down. Or such as the shape of your spine. Oh, you've got too much curve in your spine. Oh, you've got too little curve in your spine. Oh, you've got a leg length discrepancy. Well, we just talked about side bending problems. Side bending problems are most commonly misunderstood as leg length discrepancies. Right. Because people see one pelvis higher than the other and assume that one leg must be longer. In the last 20 years, I've probably met 2 people who actually had true leg length discrepancies who have side bending problems. It's a functional compensation pattern. All right. So what are there's a really easy test to figure out whether your shoulder girdle system is the cause of your neck pain or headaches. And I'm going to take you through that right now.
Oh, perfect.
Okay? And you can do this with your next chronic neck pain patient. I can almost guarantee that this will be the source of their pain. All right.
All right.
So folks, if you have pain, what you're going to do is you're going to stand there and you're going to turn your head left and right and look up and look down and get a sense of where your pain is in that range of motion, how much it is, how difficult it is to turn, all that kind of stuff. All right. And then you're going to have someone stand behind you. And what they're going to do is they're going to put their hands in under your armpits, and they're going to lift your shoulder blades up about a ½ inch to an inch higher than normal. I would say, let's say an inch. All right. And then they're going to jiggle those shoulder blades a little bit to get you to relax. Your job is to relax your shoulders completely into their hands. Now, the arms weigh about 30 pounds, right? Including the shoulder girdle system. So find a helper who's strong enough to hold up 30 pounds with their hands. All right. So they're going to do this for about 30 seconds and hold these up for you. And then what you're going to do is you're going to turn your head left, right, up and down again and see if that is less painful, easier, you have greater range of motion, all sorts of things. Okay. And so almost guaranteed you will. And so that is confirming that the shoulder blade system is causing, or one of the major causes of your neck pain or headaches, because that's only a 30-second test. And most people feel between a 30 to 100% reduction in their pain when they do this test. All right, instantly. And then the second part of the test is you lower the shoulder blades back down, and suddenly you feel the weight of your upper body system on your neck again, and your pain instantly returns.
Mm-hmm.
Right? So that's further confirmation that this is this problem system. Now, you can't shrug your shoulders up to do this test.
I was just trying to do that. Yeah.
Because what you're doing is activating all the muscles that are causing the problems in the first place. So you're not going to get a positive result. You have to have someone passively do this for you. All right. So the caveat to this test is that a lot of people with chronic neck pain and headaches are so much in chronic pain that they can't relax their shoulder blades into someone's hands. All right. And so I have found that I stay there maybe 60 seconds instead of 30 seconds and really trying to get them to relax and really have them give me their weight. And sometimes what I'll do is I'll get them to relax their knees and flex their knees to drop their whole body onto my hands. And I hold them up like this because their tension pattern is through their whole body instead of just the shoulder and neck. All right. So even if these people can't, if you can stay there for 30 seconds and they say, oh, I don't feel any change. Once you lower those shoulder blades back down, they're going to suddenly feel more pain again. This will be their confirmation that, oh my God, it is my shoulder girdle system. You can solve this, folks. This is so easy to solve. And once you understand that it's the shoulder blade system, you're going to start looking in the right place for your treatment. Until now, you've been looking at people who are treating your neck, all the myriad of tissues in your neck that can be treated, suboccipitals, all sorts of things. But it's not. These are just responding to the larger forces being delivered through here. And we can talk about a habit that's causing this.
Okay. Yeah, please do.
All right. So what this is showing us is that scapular depression is the major cause of most neck pain and headaches, which means that their shoulder blades resting too low are the biggest culprit. Okay. So why would the shoulder blades be resting too low? Well, how many of you have been to a yoga class where they've told you to bring your shoulder blades down and back into the opposite back pockets? How many of you try to create an erect posture using your shoulders to squeeze them together in the back? That's an artificial construct. Your shoulder blades have no business creating posture. That is not their role. The role of the shoulder blade is to assist the arm in overhead motions, not create posture. Look, it rests on the outside of the rib cage. How could that possibly be the main source of our posture, generation? It's not. It's artificial. And the reason that this has become really common in our society is because I believe of dance. When you look at dancers, especially ballet dancers, they have these really long necks, and that's been seen as aesthetically pleasing. And so I believe that those aesthetics have bled into yoga, Pilates, gymnastics, all sorts of things, where now people are saying, okay, let's get our long necks, right? Let's bring our shoulder blades down and back. And the way you create a long neck is by pushing the shoulder blades down. But it's causing bigger problems, right? It may look pretty, but it's causing problems. All right. So here's how you should be doing posture. All right. So put one hand up on your chest and the other hand on your belly. Folks, do this at home. You'll really feel this is pretty amazing here. So what I'd like you to do is you've got one hand on your chest, the other hand on your belly. You're going to take a nice deep breath in. And you're going to feel the rib cage rise. And then exhale, and you'll feel the rib cage lower as you exhale. Okay. So let's go ahead and lift the rib cage again by inhaling. Exhale all the way, but this time, don't let the rib cage go down all the way. Let it go down 99.9% of the way, but hold it up 1 millimeter higher than what you're used to. And when you do that, you can exhale all the way though, if you want. When you do that, you'll find that your stomach muscles have just engaged maybe 5%, maybe 10%, very subtly. All right. This is your core holding up your rib cage. This is what you're supposed to do with your core. All right. That's why we have so much of it and so many layers of it. It's because the whole rib cage and upper body system weighs a lot. It's got to hold this thing up. All right. Now, the second part of this equation then is to bring your arms down by your sides and roll around your shoulders and relax them completely like two loose dangling ropes by your sides. And what you'll notice is when your arms are completely relaxed, you've also just let go of your core muscles. The reason that has happened is because you've tied your posture to your shoulder tension instead of core. And so this is how you dissociate those two messages, right? Just like when we had you clasping the fingers, this is something bad and wrong. Well, the wrong part isn't necessarily true. We've got to separate those messages. And that's the same thing with shoulders and core. The core can turn on without the help of the shoulders. You're using your shoulders because you've been trained to use your shoulders, but it's not correct. And this is what's contributing to a lot of chronic neck pain and headaches, because the more you use your shoulders, the more you're activating the scapular depressors. There are far more scapular depressors, and they are much larger in your body than you have scapular elevators.
Awesome. So did you recommend belly breathing, trying to get more air into the lower abdomen? No. Okay.
No, let's not complicate things. Breathe any way you want to breathe. I don't care. Just hold the rib cage up slightly, and however you want to breathe is correct. Because breathing isn't the reason why you're using your shoulder blades to create good posture, right?
Right.
And breathing isn't the reason why why you're letting the rib cage fall while squeezing the shoulder blades back. Breathing has nothing to do with that.
Yeah, so I mean, I actually did look at a lot of scapular function, and would look at glenohumeral stability and all that sort of thing. But I was always still, if you had neck pain, I was like, it's upper cross, it's tight,
right,
upper pec muscles, it's weaker rhomboids, it's weaker deep neck flexors, and it's tight, extensors. And so
those are all responses to a scapular depression problem.
So that's more the root cause, right?
Yes. And so, like, for instance, I just treated someone who had radiculopathy into his hands, right? And we in medicine were trained, oh, you've got radicular symptoms. It must be coming from your neck, right? Well, this guy, true to form, had a disc herniation in his neck. He was about to have surgery, but he wanted one more opinion. Do I really need this surgery? So he was 90% better in 1 week after months of radicular symptoms. Where was his problem? Scapula. Once we fixed that, now he's 100% better. Not even any neck pain. Have we changed the disc herniation? I don't know. He won't get another MRI. No one ever does after they feel better, right? So I don't know what the long-term effects of fixing systems on correcting disc herniations are. I think it would be a great research study. But I'm telling you, folks, 99% of the cases, any kind of neck, headaches, radicular symptoms, anything that anyone has said has been coming from your neck is actually ultimately coming from the shoulder girdle system, likely, which is then stressing the neck, creating the structural issues that then cause the radicular symptoms down your arms.
So, and please excuse me if I'm being repetitive or asking the same question over and over again. So to get our neck or get our shoulder girdle in place, we are going to try to have that long neck and depress our shoulder. We're going to try to have some elevation please correct me. What are some cues? And what are some cues?
Once you stop using your shoulders to create posture, using your shoulders to create posture is what's pulling the shoulder blades down. If you simply stop doing that, that's all you need to do. You don't need to elevate the shoulders. Just stop. It's like what they say, what's the first thing you do when you find yourself in a hole? Stop digging, right? So that's what you're doing. If you just stop using your shoulder blades to create posture, stop digging that hole. And you'll find that your neck pain and headaches will start to feel much better very quickly because you're just not depressing them anymore. Just relax them.
So if you find yourself, and I'm just trying to be repetitive so everyone can get a good picture
Yeah.
here, but if you find yourself trying to correct your posture by what I'm doing right here is tightening my
Hmm.
shoulders and just
Yep.
relaxing, just kind of
Just let it go.
breathing, not focusing on it. And you're saying that's going to help us with that shoulder girdle issue. Is there anything else? I know you gave us some great stretches
Hmm.
for the quads and the thighs earlier. Is there any stretches you recommend
Oh, of course.
for
Yeah.
this?
Yeah. So also don't forget, I don't want people to forget the second part of that correction though, is that you have to learn how to hold your rib cage in a way that your core is holding up your posture instead of your shoulders. So remember, just lift the rib cage a millimeter. That's all you need. You don't, more is not better, because guess what? If you lift more, now we're engaging that whole extension problem
Yeah,
pattern that
yeah,
we
sure.
talked about at the very beginning, right? So more is not better. Just a little bit and you'll feel that the muscles activate naturally. Now, also, I want to reiterate is that the goal is not to contract your core muscles. Notice that I never asked you to contract any core muscles at all. They're going to contract naturally to the degree they need to be contracted just by you holding your posture better and using a better strategy. Just like when we walk with soft knees and having our body come over our foot at foot strike is going to naturally turn on the muscles in our system, turn them on as well as turn others off. So, don't overthink it. We tend to overdo things. And so I
Oh
just want to
yeah,
make sure that people don't go around, oh, well, if I get 5% with this, if I do 30%, then I'll really get it. Well, now look what's going on. You're
sure.
creating tension all over the place, right? So relax. That's the problem. So to answer your question about a simple exercise, one of the simplest exercises I do is, that child's pose exercise where you're on your hands and knees and then you sit back on your heels, keeping your hands where they were.
Yeah. Yep.
That's it. So what you can do is do the child's pose exercise, and what you'll do is when you sit back in the heels, you're going to feel a stretch through your armpit area and shoulder. Well, these are scapular depressors. So what you're doing with that exercise is the stretch. You're like this starting, and then as you sit back on your heels, your arms are like this. And what they're doing, because your hands are anchored on the ground, it's pulling the system up for you, and therefore stretching the depressors that are pulling everything down. So this is a great way. If you do that armpit test, and let's say you turn, oh yeah, every time I turn left about 40 degrees, I feel that neck pain. Then, so you do that test, you do the child's pose with the stretch. You can walk your hands to one side, you can walk your hands to the other if you want to. Get a nice deep stretch there. Stand back up and retest, and I can almost guarantee that neck pain will be significantly reduced. It's not reduced because we taught you to shrug your shoulders up. It's reduced because we stretched the scapular depressors and got you to turn those off more.
Yeah, quit overusing them. Not thinking about it too. So I just had a thought, and I want to see your thoughts on this thought. When I used to have excruciating, pinched nerve, stabbing pain, right in between my shoulder blades, and I was just rolling the lacrosse ball. I was stretching my pecs, constantly doing this stuff, upper cross stuff, laying the foam roller, all that sort of thing. And it wasn't still, I discovered magnesium, and I started taking that. And now I might think it just the magnesium, because it's so great for so many things, but one is stress and reducing stress, that maybe it had me quit thinking in the stress posture. And I just kind of let everything kind of fall to where it's supposed to be, because when I started taking magnesium, that pain went away. And so, I know magnesium has some effects on the muscle tissue itself, but I think it's more that sympathetic dominance that sometimes we get in, where you just start tensing muscles because we're trying too hard. So I don't know. I just started thinking that when he said, hey, we're trying too hard, and maybe the magnesium kind of relaxed me a little bit into that more parasympathetic state.
Yeah, we as physical therapists aren't trained in dietary nutritional stuff. We're not allowed to talk to people about that kind of stuff. So that's not my wheelhouse. But if you say magnesium helps us relax, I have no way of knowing one way or another, and it worked for you, then great. And what this does is that's a great story, because it emphasizes that some of us are closer to our solutions than others, right? So some people, that magnesium might be all that you need to relax a little bit more and stop this contraction pattern, right? You may be absolutely correct. But others will say, you know what, it didn't do a thing for me. Well, it doesn't mean that magnesium doesn't relax you. it means that your problems are larger than just that magnesium can solve.
Sure.
Right? So that's why sometimes there's a multifaceted approach to solving these problems. But in my experience, if you're dealing with chronic pain, you can't get away from the biomechanical, movement habit, musculoskeletal aspect of this pain if you want a long-term solution.
And what I like about your tips, Rick, is that you're telling us that it's okay to sit, because we have to sit. You know,
Yeah.
we hear these studies that sitting is the new smoking, that can cause anxiety, that can cause stress, because like, what are we supposed to do? We have to sit. And to be
I don't
honest, Rick,
believe it.
yeah, you know, and I used to believe that, and I would prescribe stretches. And Rick, I used to stretch all the time. I've always been tight, and honestly, I haven't stretched that much for me, and I
Yeah.
don't have as much pain anymore. I don't know what that correlation is, but it's probably because I'm not thinking about it as I used to. So
Can I talk to you about that for just a
yeah,
second?
sure.
Okay. So Dr. Thomas Hanna talks about neural tension patterns that are occurring in the body. These neural tension patterns occur from head to toe, just like Thomas Meyer's fascial superhighways, right? And so when we have tension, what's happening often is that we are contracting muscles, not only here or there or whatever, throughout the whole superhighway of tissues. So what you've just told me about your magnesium is that it relaxes you.
Mm-hmm.
So it's probably not just relaxing right here where you were having pain. If it's relaxing you, it's likely affecting you systemically and relaxing you
Right.
systemically.
Of course. Yeah.
So if you have a chronically tense muscle, that will test as a short muscle, just as if it was chronically tight. But having a tight muscle is different than a tense muscle, even though they both result in a shortened muscle.
Mm-hmm.
If you stretch a tight muscle, it will stay stretched. If you stretch a tense muscle, it will recontract again. So when I hear your story about, gosh, and stretching seemed to me making things worse, and when I stopped stretching, everything felt better, right? But I feel looser, then that's telling me that maybe you weren't stretching tight muscles, you were stretching tense muscles. And by taking the magnesium, you're relaxing the tension pattern in your body. Therefore, you don't feel the need to stretch anymore because nothing feels short anymore, because the shortness was actually derived from tension rather than tightness.
Yeah.
Does that make sense?
That makes sense. Yeah, it makes great sense to me, for sure. Thank you for that. So Rick, I know you're giving away a ton of free secrets right now. And we went over two of the major causes of chronic pain, which is neck pain. Migraines are also connected to that, headaches as well, and low back pain. And I know this is included in your book, but is there anything else, that's common that you think you could share, or would you like to direct people more to the resources that you have?
Well, I think there's one more common problem that's occurring in the hip, because there's a lot of people with hip pain out there.
Okay.
And I just want to tell them
please.
What's mostly overlooked by most practitioners, okay, is that here's the hip socket, all right? And when we move the leg, it should be pivoting in the socket. But oftentimes what's happening is that the thigh bone in the hip socket is not just pivoting, it's sliding forward and pivoting. It's called an anterior femoral glide syndrome. Anterior means forward, femoral glide, and then a syndrome means that there's a multitude of issues that are surrounding this. Okay, so what this does is you can imagine that if this is gliding forward in an anterior femoral glide syndrome, it's like a washing machine that's kind of out of balance, and it's just careening around that whole hip socket, breaking down labrum, cartilage, causing bursitis, all sorts of things. Okay, so with this problem, you can have groin pain because it's pinching tissue in the front, especially if you've developed a femoral acetabular impingement syndrome, right? You can have bursitis pain because the IT band that's coming down to the outside should be coming down in a certain point on that bursa. And if the whole thigh bone has shifted forward, now the IT band is pressing on a different portion of that bursa, irritating it. It can cause piriformis pain because the piriformis is trying to hold on to that femur head to pull it back, causing spasm in the piriformis. And lastly, it'll be diagnosed as global hip arthritic pain because, frankly, it's just going to irritate the whole hip joint. So why is this happening? The main reason why this is happening is because the controller of the hip in the hip socket is primarily done by the butt muscle. The butt muscle starts here at the sacrum and inserts into the top of the thigh bone. When the butt muscle isn't working well, the guys deeper to it have to work harder. And so when the butt muscle is working well, it creates a pivot point for the hip joint to work. When it's not working well, it starts to let go, and that's when you start to get that migration of the hip joint. So this causes all sorts of, including SI joint pain, sciatic pain, all sorts of hip pain issues. But this is the problem that's going on, is that you've got an anterior femoral glide syndrome. And frankly, I just had a woman who was scheduled for hip replacement surgery 2 weeks out, and she did my hip pain program. And within a week, she was 50% better. And within 2 weeks, 100% better, and has been 100% better ever since.
That's amazing.
Why?
Yeah.
Because we got her butt to work correctly in that program. All right. And that's it. So what is it that's turning off the butt? Why wouldn't the butt be working correctly? It goes back to our old friend, the knees.
Mm-hmm.
When you lock the knees, it turns off the butt muscles, which then allows the hip joint to start to become sloppy. So this is what I'm talking about. When you throw a pebble in a pond with system solutions, you get these huge ripple effects. If you just, and the pebbles are small, they're very subtle. I mean, unlocking the knees is a small, easy, innocuous habit to change. But look at all of the ripple effects it has up and down your system to change one small habit. And that's why we had in my clinic, the cures seemed like miracles, right? I can't believe that just solved my pain. Well, it solved your pain because we're looking at you and solving things from a systems standpoint. That's how it is when you solve systems problems. And so that's what's going on behind most hip pain.
Thank you for that. And so I just want to add to that, because there's always different terminology and focus points in this industry, as you know, and
Sure.
we'd always say it's the glute medius, it's asleep, it has amnesia. And I know that's not the right term, but we would focus on, glute medius strengthening, side hip raises, side lying raises, lateral leg walks, you name it, because we would say, hey, we work in this, this frontal plane, we don't work in the sagittal plane. But if we don't work on the root cause of the gait to begin with, we can do all the strengthening in the world, but it's going to go right back to that bad pattern, as you just said.
Absolutely. And so you brought up gluteus medius, and folks at home, the gluteus medius runs along the outside of the hip or the pelvis to the hip bone. So now, knowing that, since you brought up gluteus medius, how would the gluteus medius be affected if you have a side bending problem? Right? So you can strengthen this all you want, but it's not going to correct the side bending problem.
Right.
Right. Or maybe this one will seem tight or stronger, and this one will be weaker. It doesn't, so that's why you always have to look at the root cause. But the glute medius strengthening, and that helps a lot of people. But if you've been doing glute medius strengthening and it doesn't help you, it's because there are larger systemic patterns going on that the glute medius isn't getting to. And this is why. It's not that you're broken, it's that you haven't had the right information yet.
Love it. Love it. Is there any, you pretty much just said it, but it's looking through causes, looking at the knees, it's looking at the hips, it's looking at the whole integrated system as one unit. And then also for the neck pain, as you stated, just kind of relaxing, getting that rib cage to come up, not down, which so many people tend to do when they get their posture correct. Rick, this has been truly insightful, and I really want to thank you for your time and your energy and for giving us so much great information in one session. I would actually like to do this again to continue this. I think we're going to have some questions over, looking at different things, but where can people find you? Where can people find these resources? Because, you've basically laid out the framework to getting out of pain, but where can people find your book, your other books? Where can they find all that stuff?
Yeah. So again, my name is Rick Olderman, opposite of younger woman. So you can find all my books on Amazon, and my recent one is called Solving the Pain Puzzle. And if you're not a medical person, but you're in pain, then this is the one that you should read to really understand what I'm talking about, because this will help you frame how you've been thinking about your pain incorrectly and how to think about it correctly. So you'll see your story in all of these people's stories that are in here, because I have stories from head to toe. And it also includes, dietary issues, psychological issues, biomechanical issues, all sorts of things that are contributing to these people's chronic pain that we solve. So, and then my Fixing You series on Amazon is the more nuts and bolts mechanical, explanations of what's going on. But if you go to rick@rickolderman.com, I'm sorry, if you go to rickolderman.com, you'll find all of my digital home programs to solve pain. You'll find all of my books there. I've got some free stuff there. I've even created a practitioners training program, online training program to teach practitioners this. And my belief, Robert, is that everyone from coaches to surgeons need to understand how the body works. And if, for instance, because most people go to their coaches or personal trainers or Pilates instructors or yoga instructors first before they ever come to you and me, right? If those people understood the nuts and bolts of how to solve pain and how to assess the body correctly, we would be put out of business because, and I would love that, I would love to be put out of business because all of these first line of attack people are solving all the pain, and that's the way it should be.
Sure. But it's not there yet. So
not there yet. And that's what keeps me in business.
Yes. But I really appreciate everything you shared today and the way that you did it, and just giving people just something to go off of. If they have low back pain, they can try these things out. And of course, they go guys, if you got relief, from this, go get Rick's book, support him and support his work. We didn't even get to talk about dietary factors and how that can affect some musculoskeletal pain. I definitely want to cover that next. But I know we don't have time. Or maybe we do. But for next time, I would like to cover that. But I want to ask Rick just a few questions that I like to typically ask my guests. And Rick, I know, putting you on the spot here. And so one of the questions.
Now I'm worried for the first time.
Don't pull those shoulders back, right? No, I'm just kidding. All right. So, Rick, if you could put a billboard up in Denver, Colorado, on one of the major highways, and this is a free billboard that you get to do, what one or two sentences of health-related advice would you want everyone passing that billboard to see?
I've already said it. I would say you are not broken. You haven't had the right information yet.
Love it. Simple answer. You're ready to go with that one. Okay, here's another one. If you were on a deserted island and you can only pick one health-related device, it could be anything really. There's so many different answers to this. What would you take with you and why?
Maybe a rope.
Okay.
to help me stretch. I mean, I don't need health-related devices.
Yeah.
That's a nice thing when you fix systems. You don't need those kind of devices. So maybe a rope to help me stretch something, like a hamstring or something. Or a rope has a lot of utility. So I could do lots of things with a rope.
Yes. And Rick, what does your current exercise routine look like? What is your current, warm up? Do you warm up? Do you have a morning routine? What does that look like for you?
Yeah. So 2 days a week, I do 100 push-ups, sit-ups, and squats. And then a third day of week, I do a half hour kind of high intensity training. I wouldn't say high intensity. It's a difficult weight training routine for about a half hour. And then the other 3 days of the week, I typically do trail running. And, that varies in its distance. And then I have 1 day a week that I'm completely off.
Perfect. Thank you for sharing that. Is there any specific, prehab or rehab drills that you like to just incorporate to your daily routine, or do you not need that because you've kind of solved all of your chronic pain with the systems-based approach?
Yeah, I just kind of pay attention to my habits. For instance, like I just wrote this book, and like I mentioned at the beginning of the show, I have neurological damage in my left shoulder and neck. And so when I write, that kind of creeps up, but I know exactly why it's creeping up. And so, and after this book, I've already written another book, and now I'm working on even another book.
Oh, wow.
So my neck and shoulder have been really irritated from all of this book writing activity. But I've just finally taken my own medicine and changed my ergonomics because I'm just spending more and more time writing. So I thought, okay, now it's time to devote time to changing my ergonomics. And that has pretty much completely taken away my pain. So once you understand what's at the root of your pain, it's easy to solve it. And that's kind of what I do throughout the day is I just monitor loosely what's going on with my body and correct things when needed.
Perfect. Thank you for that. So what is your current writing schedule? Just curious, because I'm currently writing a book and just kind of see what your schedule is like.
Oh, my writing schedule?
How much time do you dedicate a day, or is it a week type
Gosh,
basis?
it's really haphazard right now because I've gone digital with all these home programs. There's a lot of techie stuff that I have to be involved with, which I
Mm,
absolutely hate to do. So that's really taken a lot of my time during the days. And so I'll sneak in, hopefully a half hour or an hour of writing, a day or every other day or something like that if I can. And it's always too short as far as I'm concerned.
right. It's never enough. I know it's
Yeah.
such a struggle for me. Because sometimes I get in the zone, I can be writing for way longer than I anticipated, but
Yes.
sometimes it just takes me forever to even get started. So
Right.
yes, the struggle is definitely real. Um,
Yeah.
so Rick, is there anything else that you would like to cover that maybe I didn't ask that you wanted to just kind of rehash one more time, or do you think we covered it for the most part?
I think we covered it for the most part. I think the thing that I run into most is people's skepticism. And I find that people's skepticism, especially when they've been around to a lot of practitioners or have been told certain things, that this information is so different than what they've heard before that they're very skeptical that it could possibly work and work so well. But I'm telling you, the body's natural state is not to be in pain. And the fact that you keep wrestling with pain means that you're not getting that right information. And I truly believe that I have it for you. I've dedicated 25 years to it, and I think I've uncovered most of the causes. I think I have something that'll help you.
Rick, I think you do too. And so I just want to say thank you again for coming on today, sharing all your wisdom with us. And I look forward to another conversation with you, hopefully down the road. So thank you
Thank
again.
you, Robert. You've been great. Thank you.
Thank you.
Thanks for listening to the Fredrickson Health Show. This podcast is for educational purposes only and not intended to be used as personalized medical advice. Be sure to subscribe to this podcast so you don't miss a single episode. While you're at it, leave us a rating and review. Follow us on social media and subscribe to our email newsletter for more information.